Can you share your screen, sir?
Yeah, 1 second. Sharing the screen. Yeah. Okay. Shall I start? Everyone. So okay.
Sir, yes, sir.
Okay. Hi everyone. So welcome to this another session of anatomy, and I'm Dr. Ankit, your anatomy educator, and today in Auricle we are going to start the head and neck, and this is exam master live classes. These are all the points of the exam mastery live classes. You can see over here, having rapid revision of the topics, right? And you have this volatile topics revision, and everything. So it's going to be beneficial, not just for the university exams, but also for our NEET PG or FMG aspirants as well. Meanwhile, you can also use the code Dr. Ankit 20 for various other discounts and for subscription. So today we are going to start head and neck, as I already told you, and the topic that we are going to start is the osteology, right? Osteology of head and neck. Some questions over here, long questions like supraorbital fissure and related foramens can be asked. So we'll be discussing the foramens also. And hyoid bone has come as a question, but we'll discuss other bones as well over here. Numerous other short questions and answers written over here, like named pair bones, fontanelle, bragma, nasion, all the important landmarks that we see in the skull, asterion, and other foramens as well. All these are going to discuss in detail in the coming 1 hour. The core features of Auricle, you all must be aware of it. These are all the core features. We have the live classes, we have the recorded classes, we have the notes, and we also have this MCQs as well, right? Okay. And 3 subscription plans are there. As I told already that you can use the code below, that is Dr. K20. The subscription plans over here are from the basic plan. We have this basic plan, which is for 3 months. And then we have this plan for standard for 6 months and mentorship plan for whole 1 year. The plans are from ranging from 15,000 to goes up till the 50,000 for our whole 1 year plan. Okay. So these are all the features, and let's straight away head on to our class now. Okay. So let's see the class over here, and the osteology is what we are going to start up today. Okay, just a second. Okay. So, right. So here we go. And this is the osteology part. As we all know, osteology part is very important. So the various bones is what we are going to discuss today, as well as other features too. So let's start with the bones. So we'll start with the ethmoid bone. Okay, going to start with the ethmoid bone over here. And subsequently, we'll go and discuss other important points. So ethmoid bone. Ethmoid bone is actually famous for all the ethmoidal paranasal air sinuses. Okay, ethmoid, we all know. There are various paranasal air sinuses. Ethmoid, we have anterior, middle, and the posterior ethmoid air sinuses. So air sinuses are paranasal, so it is situated around the nose. Okay, so let us see the details of it. So here we have some details. Like the ethmoid bone is present between the nasal bone and orbit. So as I already told that we have the paranasal air sinuses, right? So this is the nose over here. Here we have the nasal bone, right at the upper part of the nose. And then here we have the eyeball locked inside the orbit. So it is between the nasal bone over here and the orbit over here. We have the nasal sinuses, ethmoid bone over here, having the ethmoid paranasal air sinuses. Now, there's an important feature. I'm going to highlight the important features. Kindly note them. We have something known as lamina papyracea. It is a paper thin bone, right? It is a paper thin bone at the medial wall of orbit, which actually separates the ethmoid bone from the orbit. Now, let me tell you in a practical way. Whenever the skull is handed over to you in your dissection hall, if you hold the skull from the orbit, right, you'll always see that medial wall of the orbit is somewhat cracked. Okay, that is actually the wrong way to hold the bone, because the cracked part of medial wall is the lamina papyracea. It is so thin that if you hold the skull like this in your dissection hall, then it can easily be cracked. So the ideal way to hold the skull is through the foramen magnum. Okay? So that is the lamina papyracea. You have to know it. Now, other parts of the ethmoid bone are, remember, there's a perpendicular plate in ethmoid bone. Now, perpendicular is this, right? This is perpendicular that we study in our normal school classes. It forms a medial wall of nasal septum. So this ethmoid bone forms a part of nasal septum, the upper part of nasal septum. Okay. Then you also must have heard of the cribriform plate of ethmoid. Now, what do we mean by cribriform is your sieve-like. Sieve mean having small holes inside. Now that forms what the roof. If I ask you over here that can you name a cranial nerve which passes through this cribriform plate of ethmoid? It is our first cranial nerve, that is the olfactory nerve. So basically, we have the olfactory nerve, which nerve? Olfactory nerve, the nerve of smell, which passes, whose nerve roots passes through this cribriform plate of ethmoid. Remember, that is a frequently asked question. Okay. Then remember that in the lateral wall of nose, right, we have terminates. In the lateral wall of nose, we have terminates. What are terminates? Terminates also known as concha. Let me write over here. The terminates are also known as CONCHAE, concha. They are the structures which are increasing the surface area. So that when you inhale, exhale, the air passes through increased surface area so that the temperature or the humidity of the air is maintained. So remember, in the ethmoid bone carries two pairs or two, each side will have two terminates. They are known as the superior and the middle terminate. So we have what? We have a superior terminate and we have a middle terminate. It tells us over here, which is also a very famous question, that what about the inferior terminate? So remember, inferior terminate. Which terminate? Inferior terminate. It is a separate bone, right? So that is a very famous question in your PG exam also. The inferior terminate or the inferior concha is a separate bone. Okay, please note it down. The superior and the middle are a part of ethmoid bone. It also has a insonate process. It also has a hiatus semilinaris. Yeah, superior middle terminate are a part of ethmoid that we have discussed. So important points are this for the ethmoid. Now, very beautifully, we have 4 diagrams, 4 images over here. Let me zoom it a bit. Now, see, if you look from the cranial floor, right? If you look from the cranial floor, when you remove the wall, this is the area where you look at the ethmoid bone. Now, if I ask you which nerves are coming out from here, you'll say the first cranial nerve, that is the olfactory nerve. If you look at from the orbital side that is orbit, right over here. Okay, so it forms the medial wall. So here you can see this green marking. This is the ethmoid bone. It is a part of the medial wall of orbit. So here you will have the nose over here, and this is, imagine, the left orbit over here. And if you look at the mid-sagittal view, lower down, then you can see this big ethmoid bone. So what it is forming over here, this is the perpendicular plate of ethmoid. And what was it forming? Yes, it was forming the part of the upper part of the nasal septum. Upper part of the nasal septum. Another view, very important, look at the coronal view. Now, this coronal view is frequently seen when you take a CT scan, right? When do we take a CT scan? Suppose there's a patient of chronic sinusitis, there's a patient having recurrent chronic sinusitis, other problems in the nose or a paranasal air sinuses, we take a coronal CT. Here you can see this whole area, this is all part of ethmoid. What are these, all of these things? Now here you can see this very irregular shape now. All of these are paranasal air sinuses. These are all our ethmoidal air sinuses, right? And you can see how complicated it is. This is our ethmoid bone on both the sides, right? So do remember all of these views. I'm sure by looking at all of these 4 views, you can understand the anatomy or the exact location, at least of the ethmoid bone. Okay, as you go down, you also see over here at the lateral wall of nasal cavity. Lateral wall of nasal cavity, we said there are 2 concas or terminates, right? So we have a superior and a middle concha or a terminate over here. Now, what is this over here? This is our inferior. This is our inferior concha or terminate, same thing. It is, remember, it is a separate bone. It is not a part of ethmoid bone. Same over here, you can see a coronal section of nasal cavities. These are the concas. Okay, so these are the concas, superior over here, middle over here, and this is the I for inferior. So I hope the ethmoid bone location is clear to you, right? That is very important. As I at MBBS level, or if you're even giving for PG exams, at least you should know where exactly is the ethmoid bone, what are the various concas over here. Next, we come on to this vomer bone, vomer. Okay, now vomer, features of vomer are, it is again a mid-sagittal. It is a mid-sagittal bone which is unpaired. It is only present at the center. So if I ask you for a common sense or a logical question, as the vomer bone is a unpaired, that is at the center, right? It is unpaired. Will it form a part of nasal septum or of the lateral wall of the nose? Obviously, it will form the part of, it is in the center nasal septum, right? So it forms a part of the nasal septum, the inferior part of the nasal septum. Do remember it. So above we have the perpendicular plate of ethmoid, and below we have the vomer bone, right? So vomer also articulates with the, you see the sphenoid bone and ethmoid bone and maxillary palatine bones. Yes, that is fine. But remember, it is a unpaired bone and it forms the part of the inferior part of the nasal septum. That is very important part. Here, two things are given. Superior part is formed by the perpendicular plate of ethmoid, and vomer forms the inferior part, and it also will have the nasopalatine vessels and nerves. We all know that inside the nasal cavity we need nerves and vessels. These are the nasopalatine vessels. Okay. Now, there's one more important joint which you should know regarding vomer. Vomer, right? Vomer bone, which is unpaired, it is single bone. It articulates with the sphenoid, right? And it forms a very important suture. Can you name it? Think about it. What will be that suture known as? That suture is actually known as shindylasis. What is that known as? It is known as shindylasis. Now, if you go to our lectures on general anatomy, we have discussed the joints. We mentioned there just a little bit of the joint known as shindylasis. It is a joint between the vomer bone and the SPH dot, that is a sphenoid. This joint is also known as the ridge and groove joint. It is known as the ridge and groove joint. It is actually a suture. So it will come in which category of joint? It is a suture. So it will come into which category of joint? Fibrous, cartilaginous, or synovial? The correct answer over here will be it is an example of a fibrous joint. Well, it is a suture. Okay, so remember this. That is an important part of the vomer. Anteriorly, as you can see, that it articulates with the perpendicular plate of ethmoid, forming the nasal septum. That is sufficient for the vomer bone. Now, in the images, identify the vomer. Now, this over here, let me highlight. This over here is actually our vomer, right? So this is the vomer over here. You can see this blue colored. So that is the inferior part of the nasal septum. And if I put an arrow over here, upper part of nasal septum, that is our perpendicular plate of E, that is the ethmoid bone. Which plate? Perpendicular plate. Okay, so that is a vomer. In a situ section, you can see this green highlighted. This is again a vomer bone. Okay, this is again the vomer bone. Unpaired. It is only one in number. There are not two vomers, there are only one vomer. Next, we come to the zygomatic bone. Okay, so these small bones, not very important, but you can't miss them, right? It will be a crime if you don't know where is vomer. At least we should know where is vomer, because that can be asked in the vivas also. Now, next comes the zygomatic bone. Which bone? Zygomatic. Now, where exactly zygomatic? Zygomatic. The prominence of the cheek, these are our cheeks, both sides, the prominence of the cheek over here, this over here and this over here. Or if we can say the inferior lateral to the orbit, this bone over here, this is the zygomatic bone, right? This is the zygomatic bone. Not this one. This bone actually below zygomatic is the maxilla, which is lodging the upper jaw teeth. That is maxilla. Maxilla mandible, we all know mandible, right? This is mandible, lower jaw. Maxilla is upper jaw. Where is zygomatic? Over here. This prominence of the cheek over here, this is the zygomatic bone. Okay, so let us see some features. So zygomatic bone is a cheekbone or malar bone, which is paired with maxilla, temporal, sphenoid, and frontal. Now, you don't need to cram all of this. Remember, this is the zygomatic bone. So it is going to form joints with all the surrounding bones, right? So what are surrounding bones? Below you have maxilla. Front, you have the frontal bone, right? Here you have the sphenoid bone deep inside, and you have the temporal bone over here. So it is forming maxilla, temporal, sphenoid, and frontal. Simple as that. It is located in the upper and the lateral part of the face, as I told you, and forms the prominence of cheek. Okay, it also forms the parts of the orbit. Which part of the orbit? The lateral wall of the orbit, then the floor of the orbit, because this is the zygomatic bone, right? This is the zygomatic bone. So it is forming a part of floor of orbit. It is also forming a part of the lateral wall of orbit, right? So this is the zygomatic bone over here. You see the images. In zygomatic bone, remember, there are 2-3 things that can be asked apart from where is it located. You have some foramen, zygomaticofacial foramen. So if you look at the skull, you'll see a small foramen over here at the prominence, that is zygomaticofacial foramen. For what? For obviously vessels and nerves, right? There's another foramen which can be asked from the zygomatic bone, that is on the inner side or the medial side of zygomatic bone, that is known as the zygomaticotemporal foramen, right? So this is zygomatic bone, this is the temporal bone on the inside, because here we have gaps. if you just palpate this, right? If you just palpate this, you'll feel a very in front of ear, in front of the pinna, you feel a very hard bone. What is this? This is the zygomatic arch, right? So this is the arch. Basically, this deep to this arch, we have a gap, but you don't feel the gap, right? Why? Because all these muscles, like temporalis muscle, masseter muscle, they are filling the gap. Okay, so on the inside of zygomatic bone, you will have a foramen that is known as zygomatic or temporal foramen. Don't forget that. Okay, so these are two things that can be asked from zygomatic bone. Okay, now the other details of zygomatic bone, you can just go through that once you can read it, and let us look at the image now. That is most important to understand. Anatomy is all about identifying. Okay, identification is the most key important part of the anatomy. So here you can see this pink highlighted structure, that is a zygomatic bone. So it is forming the floor of orbit from the lateral wall of orbit. This is the facial side. So here you have zygomatico-facial foramen. And you see this gap. Now, if I make green circles above and below zygomatic bone, these are the gaps. So inside or deep to the zygomatic bone, or you can say the medial side of zygomatic bone, on the inside you will have zygomatico-temporal foramen. So inside you will have ZT, that is zygomatico-temporal foramens, right? So remember that part of zygomatic. Here is an image of zygomatic and go through it. Let me just highlight some foramens over here. So on the outside, you are having the zygomatico-facial foramen, right? On the inside, if you see, you will find over here on the inside is zygomatico-temporal foramen as well. Okay. They also zygomatico-orbital foramen, not that important. These two are actually more importantly asked because they are easily visualized, easily seen with the naked eye. Okay, let us move to another bone, that is a lacrimal bone. Now, lacrimal. What do we mean by lacrimal? By lacrimal, we all know that in humans, we have a lacrimal gland, right? What does it do? It does lacrimation, that is formation of tears. So tears meaning why? It is related to the eyes. So bone-wise, it should be somewhere around the orbit. That is the whole point. So with the single word lacrimal, you know that is somewhat related to the orbit, right? So again, it is present where? It is present on the medial wall of orbit. Where it is present on the medial wall of orbit. That is, if I put my two fingers over here, right? Suppose in the morning when you wake up from sleep, right? You have this accumulation of some dust over here, no? The middle side of the eye, and you try to wipe it like this. So when you're doing like this, actually you are palpating just behind the nasal bone. The fingers are going towards the medial wall of orbit, right? There you have the lacrimal. So lacrimal bone is small bone in the face. It forms a medial wall of orbit. That is the most important point. It has some surfaces and borders, fine. But do remember, important part of this is that it forms the lacrimal sac. Now, what is the importance of this? This is very important, and therefore it is asked frequently because it is important for the ophthalmology, for the ophthalmology department of ophthalmology, for the ophthalmologist. Why? Because it is forming the lacrimal sac. Now, what does this lacrimal sac do? Actually, the tears are actually collected inside the lacrimal sac. So whenever we close our eye, blinking, right? Whenever we blink our eyes like this, listen to me very carefully. When we blink our eyelids, the eyelids, if you take a video recording in a slow motion camera, right? You'll see that the eyelids are going from lateral to medial side. So their eyes are washed from lateral to medial side. And the tears wash from lateral to medial side, and the tears accumulate on the medial side. Where? In the lacrimal sac. The tears accumulate in the lacrimal sac. That is what is in, right? Now, from the lacrimal sac, they go from lacrimal sac via nasolacrimal duct. And where do they open? Where does, if I ask you a question, that where does the lacrimal or where does the nasolacrimal duct finally open? So we have a lacrimal sac where the tears will accumulate. With every blink, it creates a negative pressure, right? And then the tears from lacrimal sac, they go down via nasolacrimal duct, or we call it as NLD. And where does it open? It opens into the nose. Now, where into the nose? It opens into the inferior. Okay, inferior meatus. That is around the inferior concha. It opens. The opening in the inferior concha is known as inferior meatus. Remember that. And from there, it goes to the nasopharynx. So these are the famous questions that will be asked from the lacrimal bone, right? Okay, now we have the lacrimal crest, and then the lacrimal, see all the letters, lacrimal crest that form the lacrimal sulcus and all that, right? Let us see in the image, the lacrimal bone, that is actually more important. So here, what you see is the lateral or the side view. This is the nasal bone. Nasal bone is, you can easily palpate, right? There's a nose over here, upper part of the nose, the hard structure over here. This is the nasal. Now, just behind nasal, can you see this blue colored bone? If I put some red tick marks over here, this is a maxilla bone. So this maxilla bone, you can see it's articulating with the nasal. So first we have nasal bone, behind we have the maxilla bone. And then behind maxilla, then we have the lacrimal. Can you see the small bone over here? Small bone, green colored bone over here. This is the lacrimal bone. And behind lacrimal, we have the ethmoid bone. If you look at the medial wall of orbit, so let me point out over here, put an arrow over here. This is what we are referring to, the medial wall of orbit. So what are the bones in the medial wall of orbit? Maxilla bone, not nasal bone. Nasal bone is over here. But maxilla will start with the medial wall of orbit. Then we have the lacrimal bone. Then we have the ethmoid. And lastly, we have the sphenoid bone as well, most posteriorly. So these three bones over here, MLENS, maxilla, lacrimal, ethmoid, sphenoid, they form the part of the medial wall of orbit. Do remember this. Okay. Okay, let's move ahead. And yeah, we are seeing the lacrimal bone. It is one of the smallest and most fragile bones. So as I told, most fragile bones. So if you compress it, it will break up, right? Okay, because it has a sac. Sac means it has an opening which accumulates what? Which accumulates a tears, the lacrimal secretion over here. It's essential for tear formation and secretion. Fine. So this is the lacrimal bone being shown over here. You can see this blue color right over here. This is actually the medial wall of orbit. You can see this blue colored bone. That is the lacrimal. Okay. Functions over here provides to support to the NLD, nasolacrimal duct. And as I told you, that opens where? Into the inferior meatus. These are all the questions. And what I'm telling you are the questions which are either asked in your Viva, which are either given as a small questions or which are given in your NEET, PG or FMG exam. So listen carefully, and if you want, do make notes as well. Okay. Here's the orbit that is shown to us. Here you can see the maxilla bone, lacrimal, ethmoid, and this is the sphenoid bone over here. This is all medial wall of orbit. This all is what? Medial wall of orbit. Okay. So few points over here. Now let us move to very, very important, the lower jaw bone, that is the mandible bone. It is important, obviously, right? Now let us highlight some important parts from the mandible bone. So it is a jawbone which is mobile. Open your mouth, close your mouth. You can move it on the sideways as well. This is a mobile bone, right? That is the mandible, lower jaw. It is a horseshoe shaped. It is a horseshoe shaped like this. This is a horseshoe shape. Okay. Now, just look at the video cam over here. Okay. So it has rami as well as body. So these are the two ramis. Okay. These are the rami over here. You'll see in the image as well. And this is the body of the mandible. Rami and body. Rami and body. In between the rami and the body, here we have an angle. That is known as the angle of mandible. So I repeat over here. This is the rami. Okay. This is the body. In between the rami and the body over here, where roughly we have the parotid gland over here, we have the angle of mandible, and this side and on this side. Okay, both sides we have the angle of mandible. Remember this. So let's see a few points. So body of mandible has a mandibular symphysis. This is the body, right? And where the two bodies meet, this is known as a mandibular symphysis. Again, if someone asks you theoretically, it will be a type of secondary cartilaginous joint. Okay, it lies in midline. Okay, and then let me show you the image first of all, then we come to the other parts. Here is the image. First of all, look at the image, right? That will be a better way to understand. It's an important bone over here. We are looking at a mandible. This is the ramus over here, right? This whole is the ramus. In ramus, you can see this blue colored structure. This is actually the cartilage. So this is actually known as the head of mandible. What is this? Head of mandible. And just beneath the head, can you see this constricted part? If I highlight with some reddish color over here, this will be the neck of mandible. What is this? That is the neck of mandible. So this is head, that is neck of mandible. Okay. Head is also known as condyloid process, but it is like condyles. It's known as condyloid process. Now, just in front of your ear, this is the pinna, right? This is the tragus. In front of tragus, if you put your finger like this and you open your mouth and close it, do like this. You'll see some movement over here. Some bony structure is rotating like this. That rotating bony structure is the head of mandible. So it articulates the temporal bone over here, and this forms a joint that is known as temporomandibular joint. It's a bicondylar type of joint. Okay, that is the head of mandible. Now, this is the head in the ramus. In front of this, there's another process over here. This process is known as coronoid process. What is that known as? Coronoid. Right? This is coronoid and this is condylar process or condyloid, as I already told. This is the ramus. Ramus actually is actually covered with a muscle, very, very thick muscle that is known as masseter. Now, apart from ramus, you have the body. This whole is the body of mandible. And between the ramus and body, what I told before, that here we have this structure that is known as angle. So this over here is the angle of mandible. Right? So this is the body of mandible. In the body of mandible, you have a small foramen known as mental foramen. What is that known as? It's known as mental foramen, whereas mental nerves and vessels are common. Okay, this is on the outside. Now, if you look on this side, if you look on this right side of the mandible, here, they are showing you the medial side of the mandible. So, medial to the ramus of mandible. I repeat again, medial to the ramus of mandible is a very important circle I'm making over here. A very important foramen that is known as mandibular foramen. What is that foramen? Mandibular. It is not on the outside, it is on the inner side. On the medial aspect of the ramus of mandible, we have a mandibular foramen. Inferior alveolar nerve and vessels pass from here. We'll see in the theory as well, right? This is the mandibular foramen frequently asked. Okay. Then you have submandibular fossa, sublingual fossa for submandibular and sublingual salivary glands, right? Okay. Now let us see some theory over here. And what is the theory trying to tell us? So let me highlight the important points over here. Okay. Condyloid process. Okay. Has a mandibular condyle and a neck below. Now, between this, if I draw the condyloid process and the coronoid process, this is CON, condyloid, this is COR, coronoid. In between those two, we have a mandibular notch. This is known as the mandibular notch, which separates the condyloid from the coronoid process. Okay, and it is crossed by mesenteric. So remember, where is mesenteric? Where is mandibular notch as well? The two foramens over here, as I discussed already, mandibular foramen present where? Medial or lateral aspect. On the inner side, that is a medial aspect. Mandibular foramen present on the lateral or the outside aspect. So, the which structures pass through there are important. The inferior alveolar nerve, a branch of mandibular nerve. If I ask you, mandibular nerve is a branch of which cranial nerve? Answer for that will be the fifth trigeminal. It is a third branch of trigeminal. So, mandibular nerve, branch of trigeminal, gives off inferior alveolar nerve, which passes through the mandibular foramen. Frequently asked question. Okay, so remember that inferior alveolar nerve as well as vessels. There is a mandible image we already have seen. There's detailed labeled image. You can go through it and let me highlight few important parts. Don't forget ramus and body. That is the key. Between them, you have the angle. Then you have the condylar coronoid. You have seen mandibular foramen. Obviously, don't forget mandibular foramen. Don't forget these few important points over here. If you look at the inside of mandible, just deep to this mental process over here, you have some what spines over here. These are known as mental spines, also known as genial tubercles over here. Okay, so these are also known as what? Genial tubercles. Genial tubercles. There are how many? Two pairs. One pair above, one pair below over here. Now, what do they give? What is attached over here? That is important, right? What is attached over the genial tubercles? So remember, there are two muscles. For the upper pair of genial tubercles, we have the genioglossus, the muscle, the largest muscle of which organ? Tongue. Genioglossus. And on the lower pair, we have the geniohyoid muscle. Okay, so it obviously goes to the hyoid. Remember, these genial tubercles can also be asked, where are they present? Again on the inside. Okay, deep to the, you can say inside of the mental protuberance. This is the mental protuberance on the inside of it, right? We have this on the inside of it, we have the two pair of genial tubercles. Okay. Again, the skull over here, all these vessels. So you can see there's some important vessels over here, like you see this inferior alveolar artery. It is a branch actually of maxillary artery. So it is passing where this is the area for our mandibular foramen. So inferior alveolar nerve and vessels. So remember over here, question you might get confused. Inferior alveolar nerve, inferior alveolar vessels, or can say inferior alveolar artery over here. When someone asks you about the inferior alveolar nerve, you'll say it's a branch of mandibular nerve, V3. But when they ask you inferior alveolar artery or inferior alveolar vessel or artery per se, it is not a branch of mandibular artery, it is a branch of maxillary artery. It is a branch of maxillary artery. Maxillary artery is actually a branch again from external carotid, the largest branch of external carotid artery. So remember these basic points, asked in Viva as well. Okay, nasal bone we already have seen. It forms the upper part of the nose over here. There are two pairs of nasal bones. So no, not two pair, one pair having two nasal bones. So this is left nasal, that is the right nasal. So we have one pair having two nasal bones. Between them, we are joined by the internasal suture as well. Fine. So nasal bone and articulate with few, which bones? Frontal bone over here, maxilla bone over here. So it basically articulates with the frontal and maxilla bone, right? And nasal bone, remember that this, let's look at the diagram of nasal bone. This is the nasal bone over here. This over here is the nasal bone, red highlight. Now remember, it is one of the most commonly fractured bone of the face, right? Suppose someone is punching some other person. So whenever there's a punch over here, the most prominent bone is not this. This is the cartilage, right? You can remove this. This is the hyaline cartilage. These are all the septal cartilages and the lateral alar cartilages over here. They are not bone. Most prominent bone is what? This nasal bone. So if there's a punch over here, the nasal bones are one of the most commonly fractured bones. If the punch is over here, obviously mandible will go. Because punch is on the center of the face, there are very good chances that the nasal bone will be fractured. Nasal bone will be fractured. So remember that clinical point as well. Okay. Now coming to very, very important part of foramens of skull. I'm sure you all must have gone through it. You all must be, craving to just learn where to identify the foramens, what structures pass through it. And yes, it is a very important part of the head and neck osteology. So what are the things that we need to know? Let me tell you over here. I'll show you the foramens of the skull with the help of an image, basically, where we look at the cranial fossa. So what I'm actually going to show you, first let me tell you that once you remove the vault, this is the cranial vault. Once you remove the vault and then you remove the brain, what do you see from here? What you see from here is the cranial fossa. You have the anterior cranial fossa, the middle cranial fossa, and you have the posterior cranial fossa. So this is the base of the, you can say the base of the skull, or you can say the base of the brain where the brain is sitting. This is the fossa. So if you look from here, you'll see various openings. Those openings are in the cranial fossa. So we have the anterior, we have the middle, and we have the posterior cranial fossa. Now, looking at the fossa itself is not complete. Inside the fossa, you have to, first of all, number one point is you have to locate the foramens. Suppose someone asks you where is foramen spinosum. Now you say, okay, sir, I have heard of this, but I'm not able to identify. No, we have to locate the asked foramens. First number point. Second point is we should know what are the major structures that pass through it. What are the major structures that are passing through the foramen? Before going to details of all of these foramens, let me tell you, or let me ask you, you can answer yourself also, that what structures actually pass through foramens? What will pass through foramens? See, what is inside the skull? We have the brain. So what will pass through foramens? Either the afferent nerves or the efferent nerves. So there will obviously be nerves. Which nerves? Cranial nerves. Not all, but cranial nerves, only 12 pair of cranial nerves. 12 on the left, 12 on the right side. So 12 pair of cranial nerves. Second thing is, brain needs vessels. So you have the blood vessels as well. You have the blood vessels as well. Blood vessels can either go to meninges or they can go to the brain itself. So there are basically two group of structures that we normally find as a content of the foramens. Majorly two group of structures, which are either the vessels. The vessel can be artery or vein. See, artery is coming, vein is going. Sir, why not lymphatics? Lymphatics are not. Brain is devoid of lymphatics. Remember that. Or apart from the vessels, we will have the nerves. Which nerves? Not the typical spinal nerves, but basically you should know the 12 cranial nerves are passing through there. These are there are two things that we should be knowing. Okay, I hope this point is clear. Okay, now let me show an image over here, so that you can understand better. Okay, this is the image over here, and let me just enlarge it a bit over here. Okay, okay. Now let me first tell you what exactly we are seeing over here. So as I already said, we are looking at a cranial fossa. What are we looking at? We are looking at cranial fossa. We have removed the vault. This is the anterior aspect. That is the posterior aspect. Okay, anterior and posterior. You're looking at a right half of cranial fossa, on the right half. One side left half is cut over. Okay, so this is the basic thing over here. Then this area is the anterior cranial fossa. Okay, this is the middle cranial fossa, and behind you can see this magnum, that is the posterior cranial fossa. So we have the anterior cranial fossa, middle cranial fossa, and posterior cranial fossa. Now you might be looking and you might be thinking that it is all at a similar level. No. If you look at it laterally, anterior cranial fossa is higher up. Then we have middle cranial fossa. Then we have posterior cranial fossa. Do remember that. So anterior is a bit higher up. As I said over here, this is anterior cranial fossa, roof of orbit. This is orbit. So this is the anterior cranial fossa. And middle cranial fossa is over here. This is the middle cranial fossa. And then posterior cranial fossa, where you have the C1 attached to that occipital bone, this will be the posterior cranial fossa. So they are stepwise manner. Anterior is higher up, then middle, then posterior. Okay, I hope this point is clear. Now let me highlight few important foramens over here, which is written over here. See over here. This is cribriform plate. Okay, identified where it is. Then we have, first let me identify, there are at least 8 to 10 foramens that you should minimum know. Then we have the optic canal over here. Then we have the third one, superior orbital fissure over here. Then we have rotundum, ovale, and spinosum. They are known as ROS foramens, ROS. R for rotundum, O for ovale, S for spinosum. Then you should be able to identify the lacerum foramen, foramen lacerum. Then carotid canal, right? Then internal acoustic meatus. Acoustic means for the ears. Okay. Then mastoid foramen also you should know. Then a couple of more, jugular foramen and hypoglossal canal, and finally we will have the foramen magnum over here. Total 3, 4, 5, 6, 7, 8, 9, 10, 11 or 12 fracstruments, right? So these are, at least you should know where are they located. So let us go one by one and look at their contents also. Let us go one by one and look at their contents also. Okay. So starting from the anterior cranial fossa, we have the cribriform plate over here. We just talked of ethmoid bone, which now I told you first cranial nerve, olfactory nerve. Here you can see the olfactory nerve bundles. Clear? Second is the optic. Optic means optic nerve. So here you will have optic nerve and ophthalmic artery. Where it is it located? This is the optic canal. I am highlighting over here. This black circle is the optic canal. Okay, so we have, let me write the cranial nerves as well. This is the first cranial nerve done. Optic canal, second cranial nerve done. Okay. Then you have this big one. This is not just a small foramen, it's a fissure, superior orbital fissure. It is located from here to here. This is the location of superior orbital fissure. It's huge. Which nerves pass from here? Let me tell you over here. The nerves which are going to the eyeball. So you have motor nerves, third, fourth, and sixth. These are what? I'm writing M for motor nerves. Going where? To the eyeball. We need to move our eyeball, right? So we need motor nerves. So that our eyeball can go above, below, right, and left, all that. And then you need a V1, that is a sensory nerve to the eyeball. So someone touches the eye, we suddenly close our eyes. Suppose you're on a two-wheeler, you're just walking on the road and there's some dust coming. A drop of dust touches your eyeball, cornea, suddenly you close your eyes tight and you try to wipe it out. Because we know that eyes are so important structure. If you let that dust stick to your eye, it could lead to corneal ulcerations later on, right? So eyes are very sensitive, and sensation comes from this sensory nerve V1. V1 is ophthalmic division of trigeminal. So it is ophthalmic division of trigeminal. So that is supraorbital fissure. Now look over here, ROS, as I told you, ROS foramens. Let me change the color over here, right? Okay, this is blue circle R, rotundum. This is oval shaped, ovale, and that small is spinosum, right? The small one is spinosum. Okay, so this is rotundum, ovale, and spinosum. They are situated posterolaterally in this direction. First, we have rotundum. Posterolateral to it, you will have ovale. Ovale, why ovale? It is oval in shape. Ovale is like this, oval in shape. Spinosum is not having spines, but yeah, it is circular, but it is close to the spine of sphenoid bone. Therefore, we call it as foramen spinosum. This foramen is not having spines. Let me clear it. Many times students confuse us the foramen spinosum. Do we see spines inside foramen? No, you don't see spines. Because if you have spines inside foramen spinosum, see, it is having what? Middle meningeal artery and vein. So spines and vessels, not a very good combination, right? So foramen spinosum is circular, but it is situated near to the spine of sphenoid bone. So we call it as foramen spinosum. So this is ROS. Contents. Rotundum has V2, maxillary nerve. Ovale, remember, very frequently asked. Mnemonic, remember, MALE, male. Male is the mnemonic for the contents of foramen ovale. Okay, for oval, remember male. What is male? M is for mandibular nerve. So we have V3 nerve over here. A is for accessory meningeal artery. L is for lesser petrosal nerve. And E over here, male, E over here is the emissary vein. E will be the emissary veins. Emissary vein we'll see tomorrow when we'll look at the scalp anatomy. Okay, so oval, remember, the mnemonic is male, M-A-L-E. M is mandibular nerve, V3. Okay. A is axillary meningeal artery, L is lesser petrosal nerve, E is emissary vein. Again, as I told in the beginning, nerves and vessels are the major contents of the forearm. Till now, you are seeing mainly nerves and vessels. Then comes foramen spinosum, ROS, right over here, small foramen, having middle meningeal vessels and a meningeal branch of mandibular nerve. Okay. Next comes the carotid canal. So you have the internal carotid artery over here. Is it important? Yes, it is supplying the whole brain. At least more than 50% of the brain, anterior circulation of the brain coming from the internal carotid artery. So carotid canal. Then comes internal acoustic meatus. So this is the internal. So let me show you the carotid canal, which will be over here. And therefore it opens up into the foramen lacerum. So there's a lacerum also, remember. Lacerum itself has no component. You are seeing this opening now. Let me tell you over here one very important point, that this lacerum over here is actually covered by cartilage. This lacerum over here is green color. Yes, this over here. This foramen lacerum is actually covered by cartilage. So no major structures actually passes through the foramen lacerum. Carotid canal will give rise to the ICA, internal carotid artery, which will go through inside the bone, and then it will come out. Internal carotid artery will come out from here, not piercing the cartilage. Try to understand, right? Now, internal acoustic meatus is where internal acoustic meatus is right over. This is your internal acoustic hearing. Nerves over here are, at least remember, 7th and 8th cranial nerve, facial and vestibulocochlear. Now let stop over here for a while. Look which nerves we have covered. 1 to 8 we have covered. First nerve olfactory, second nerve optic, third, fourth nerve supraorbital fissure, sixth nerve supraorbital fissure. Fifth nerve, the thickest cranial nerve. Three components, V1 we have seen, V2 we have seen, V3 we have seen. So 3, 4, 5, 6, 1, 7 and 8 are coming from the internal acoustic meatus, right? Here you have the mastoid foramen that is inconstant, might or might not be present, but here look at another foramen, jugular foramen. Quite a big foramen over here. This is the jugular foramen, irregular in shape. Nerves over here are, remember, at least 9, 10, and 11. So after 7 and 8 comes what? 9, 10, 11. So these 9, 10, 11 passing through jugular foramen. And as the word is jugular, therefore, what do you remember when you hear the word jugular in head and neck? What first thing comes to your mind? So yes, jugular vein, yes. But if you look at the contents, there is no jugular vein over here. But they are looking at a sinus. Which sinus are we looking at? Is a sigmoid sinus. You see the sigmoid sinus over here? Is the content. Sigmoid sinus actually continues or it passes through jugular foramen. And as it comes out of jugular foramen, this is what is known as internal jugular vein. So internal jugular vein, where else have you heard it? It is inside this carotid sheath. And when you do a jugular vein catheterization also, it is frequently used. So internal jugular vein is quite an important vein. It is a continuation of sigmoid sinus. And due to this internal jugular vein, the foramen is also named as jugular foramen. And then we have 9 and 11, last nerve, we have hypoglossal canal. So hypoglossal nerve, 12 nerves. So you see on the right side, we have seen 12 cranial nerves either coming inside the foramen, they're either exiting or entering the foramen, depending on afferent or efferent nerve. This is the whole point, right? Lastly, the largest foramen is this, that is the foramen magnum. A lot of structures pass from here. Just go through this, right from medulla oblongata to the meninges, to the vertebral artery that is forming the post circulation, right from the spine root of accessory nerve. So 11th nerve has two roots, spine root. They all will pass through the foramen magnum, the largest foramen. Now, this is the most important part of the lecture, is this identification of the foramens, first of all, and then what passes through it. So in a nutshell, in the beginning, I told you, remember two things, nerves and vessels. Identify where are they located and what structures mainly pass through them. The more times you repeat it, the better you will understand it, right? Let's come back to our notes. Okay. And here we come again. Okay. So these are all the canals or the foramens that we have already discussed. Optic canal we have seen, superior fissure, rotundum, oval. What I'm highlighting now? These are important ones. I guess we have covered most of them or nearly all of them, right? Yes, all of them we have covered. Okay. Now there's an image over it. That is why I showed you a different image. And again, you just go through it depending on liking, and I can see all the contents passing through the various foramens. Right? Okay. Fair enough. Okay. Here, yeah. Pterygopalatine fossa. This is also an important question that might come, right? So remember, there are two, three things of the pterygopalatine fossa. First of all, let me show you this structure over here. Now, what you're seeing over here is, you can see this bone maxilla. Okay, this is the sphenoid bone that is also from the pterygoid plate. So between the maxilla bone and the pterygoid part of the sphenoid, you have a small fissure. What is this? This is a small fissure. This is known as pterygomaxillary fissure. Point number one over here. It's a small. Now there is a structure or there is a space inside deep to the pterygomaxillary fissure. That is the number two structure. That is the pterygopalatine fossa. So where it is a small area, if I show you on the face, right, if you've seen the face, this is the area where it is actually present, both sides. This is the area for pterygopalatine fossa, deep inside. Outside, you have the pterygomaxillary fissure. Pterygo, why? Pterygoid is a part of sphenoid bone and maxilla is maxilla. So maxilla bone we all know, right? This is the upper jaw bone, maxilla. Then behind you have the sphenoid pterygoid process. So here you have deep inside you have the fissure that opens into this pterygopalatine fossa over here. Okay. And as you go more medially, you have a sphenopalatine foramen, as number 3 is written over here, which is opening where? Into the nasal cavity. So see over here, pterygomaxillary fissure on the video, if you can see. Pterygomaxillary fissure outside. Then pterygopalatine fossa. Okay. Then here you have the very important foramen for the nasal cavity, that is a sphenopalatine foramen. So remember these three names. Remember these three names and how the fissure is opening into the fossa, then again foramen. So what is actually passing through the foramen? All the sensory nerves, vessels which are going to supply the entire nasal cavity, maximum part of the nasal cavity, they are passing through the sphenopalatine foramen. They are passing through the sphenopalatine foramen. Again, what is shown over here? Look in the diagram, pterygomaxillary fissure. Okay. Again, this is the maxilla. This is the pterygoid part of the sphenoid bone. This you can, if I can try to zoom it a bit more. Okay. And encircle it a bit. This is the pterygomaxillary fissure. Okay. Deep inside this, you have what? You have the pterygopalatine fossa. Do remember it. Okay. So that is the pterygopalatine fossa area. Okay. Okay. Now let's come to other basic parts, though we have done it. This is just a basic repetition. So skull has a total of 22 bones. Remember, it has 8 cranial and 14 facial bones. 14 plus 8 is around how much? 22 bones over here. Some bones we already have seen. Okay. Bones of a skull. Just go through these images, identify bones. Or before, let me just recall all the bones over here. Right? That is mandatory. So we have seen zygomatic, we have seen maxilla, we have seen mandible. Okay. This is the frontal bone over here. This is the frontal bone, unpaired. On top, we have this parietal bone paired. On sides, we have temporal bone paired. Behind, we have occipital bone unpaired. Okay. Then you have a sphenoid bone. Again, it is unpaired. So skull is saying they are having 8 bones, right? So frontal, occipital, 2 bones, 2 parietal, 2 temporal, 6 bones, right? And then you can say as a part of, say, sphenoid bone number 7, okay? And you can even call the ethmoid bone. Right? So we have around this 8 bones over in the cranial part, and then you have 14 bones in the facial bones. So these are all the labeled bones over here. I'm sure you must be knowing the basic names of it, of all of them. Yeah, these are the 3-4 normas. Normas. If you open the osteology chapter of your any textbook, skull is read through norma frontalis. You take a picture on the front of the skull, show you the important bones. Norma verticalis, norma occipitalis from behind, norma lateralis from the sides, norma basalis from below. These are 1, 2, 3, 4, 5, 5 angles. Normally, it's you see the Hollywood movies. No? In Hollywood movies, whenever there's a person who goes to the jail, they take the photographs of that criminal. No, hopefully a criminal. front photograph, then sides photograph, all that, somewhat like that, right? So focus mainly on the images over here. That be better. Okay, this is the norma verticalis at the top. You can see this is the nasal part. So this will be our basically anterior part. This will be our anterior part. This is the F for frontal bone. Normally it has a suture while development, but that closes. In few people, there can be a small suture over here that is known as metopic suture. Which suture? It is also known as metopic, M-E-T-O-P-I-C, metopic suture. And you have these two parietal bones over here. Let use a highlighter over here. Parietal bones over here. And these parietal bones are connected between by the sagittal suture. The suture is sagittal. So you have sagittal suture like this. And between the frontal bone and the two parietal, we have a coronal suture. So this hole will be the coronal. This hole is the coronal suture. And this over here is the sagittal suture. This is the sagittal suture over here. Behind, you can see the small occipital bone. And between the occipital bone and the parietal bones, you have the lambdoid suture. So you have at least three sutures. These are must know. This is very, very basic. You should identify frontal, parietal, occipital bone. I hope it is very simple. Should know sagittal suture, coronal, and lambdoid suture, where they are exactly located. Let us look at another view over here. This is going to be the posterior view, norm occipitalis from behind. So from behind, again, you're seeing the sagittal suture over here and this lambdoid suture over here, lambdoid suture. But behind you see is very big prominence. Just try to feel on the occipital bone behind. In the center, you will feel a very prominent bony structure coming out. That is known as external occipital protuberance. Okay, and the most projecting point in this external occipital protuberance is known as inion, I-N-I-O-N. That is also asked. I-N-I-O-N. The most prominent point in this protuberance. See, protuberance is a vague term. And that protuberance, the most prominent point is known as inion. Right? It's known as inion. Here you're seeing this is the mastoid process right behind the ear. You feel this bony projection coming down. It is a mastoid process. It is normally developed after 2 years of age. When the child starts to rotate the head here, right and left, no, then the sternocleidomastoid muscle develops. And when the sternocleidomastoid muscle develops, it pulls on this part of the temporal bone. That becomes the mastoid process of the temporal bone. Okay, it becomes the mastoid process of temporal. So there's a norma occipitalis. These are again, you can just go through all these labelings over here. Okay, they can easily be asked. Norma frontalis is the frontal view, right? The frontal view over here. In frontal view, all the facial bones, basically, we have seen a lot. Maxilla, we have talked of the mandible. This projecting, you can easily identify zygomatic bones. Then you've seen the nasal bone. These are the easier bones because you can easily see them on the outside. The complicated ones we have just discussed in the beginning, the lacrimals, the ethmoids over there. These are the sphenoid we'll just go through in a while. The sphenoid bones. So identify some of the important bones, go through these labelings over here. Lateralis again. This can be tricky at times. Why? The easier ones you can easily identify as frontal is this, parietal is this, occipital is this green color is temporal. How to identify it? You can see this mastoid, you can see this external acoustic meatus where you have the ear, that is what this is a temporal bone. The tricky part can come from this sphenoid bone. This is the zygomatic bone. This is the maxilla. Now, if you remember, when we discussed about the zygomatic bone, we discussed that the zygomatic bone is forming joined with how many bones? You can see over here, zygomatic is this orangish color. Let me just zoom it a bit more. So this zygomatic is articulating with the temporal, with the sphenoid, with the frontal, with the maxilla. This is zygomatic bone over here, right? This is zygomatic bone over here. Okay. So there's a zygomatic bone over here, right? So that is a prominent bone on this side. Fine. Okay. Fair enough. So there's again a diagram. Just go through it. Okay, norma basalis. Basalis is again we have all the foramens that we have seen already. Okay, so but while studying the foramens, we saw from the cranial fossa. If you just remove the whole skull and you look from below, this is how the picture looks like. This is how the picture looks like. Normally, most of the foramens are here, which you will see in the norma basalis. In norma basalis, which foramen you won't see is the foramen rotundum. So that rotundum foramen opens anteriorly. So it doesn't open down. It opens anteriorly. So you don't see rotundum over here. Here you'll see the carotid canal also can be easily seen over here. The carotid canal must be somewhat around over here. Or just a second, let me identify. It is somewhat located in front of jugular foramen. So the jugular foramen, this is the carotid canal. Okay, not labeled over here. First, initially looking at labeling. So this circle part is the carotid canal. What passes over here is the internal carotid artery. Okay, the internal carotid artery that passes from this carotid canal. Okay, maxilla bone we have seen, you can easily identify the maxilla. You can see it lodges the upper jaw. More importantly, from maxilla is asked is the maxillary air sinuses. They are the largest air sinuses inside the maxilla. See, facial bones normally are hollow. If you remember general anatomy, we talked about the pneumatic bones. Okay, most of the facial bones, like maxilla, sphenoid, ethmoid, frontal bones, they are hollow from inside. Why? Because they have air, so they decrease the weight of the facial skull as well. So remember that part as well, right? And then parietal bones we have seen can easily identify the parietal bones. So important points you can go through the labelings as well for the parietal bones. Okay, same for the occipital bone. Occipital bone, just remember, sometimes in Viva people ask what are the parts of occipital bone. So basilar part from the base, on the sides lateral part, and this flat part is known as squamous part. Let me show in the image over here, right? So the parts over here you can easily see. So this will be the squamous part. Magnum will be the basal part. On the sides, we have the lateral part of the occipital bone. This is our external occipital protuberance, as already discussed, right? Temporal bone, again, it's quite a complicated one on the sides. And even this, you have some parts of temporal bone. Again, this flat part is known as squamous part. This external acoustic meatus, this mastoid process, all of these are actually a part of the temporal bone. So it's a bit, you can say, irregular shaped bone. And the main part of temporal bone, if you, in one word, it lodges the ear. Our whole ear is quite important, right? Middle ear, inner ear, all that, it lodges inside the temporal bone. So that is one important part which you should know. All these parts are being shown over here. Images, I urge you guys to even either take a screenshot or as you have the notes, go through the notes over here or whatever source you have. Look at the images because images, just looking at the labeling of images, it's not that that difficult and it helps you in understanding. Sphenoid bone is an unimpaired bone, remember. That is a very famous confusion which normally students have, that it is an unimpaired bone. Yes, it is butterfly-shaped, huge bone. In the center, you have the body sphenoid. On the sides, you have the two pair of wings. Outside is a greater wing over here. This is a greater wing. Okay, these are greater wings. As let me highlight it. Here are the greater wings, and these small ones are the lesser wings. In the between this is all the body of sphenoid. Again, it is hollow from inside, having a sphenoid layer sinuses. If you remember pterygomaxillary fissure, these are the pterygoid plates of the sphenoid bone. They articulate with the maxilla from the fissure in between. That is pterygomaxillary fissure. Okay, sphenoid bone, very important. Go through the labelings. Couple of this is over here. Will help understanding. This whole is the one sphenoid bone. This is the body of sphenoid. These are the wings of sphenoid. Some say it's like bat shape, butterfly shape, whatever. Just imagine just anti and the posterior views of the sphenoid. And remember, we also discussed scintillatus, sphenoid and vomer. Sphenoid and vomer suture, spatial suture is scintillatus, ridge and groove, also known as ridge and groove type of suture, scintillatus, right? So that is your sphenoid bone. And finally, small palatine bone from the palate of the facial skeleton, or you can say the hard palate over here. That is the palatine bone. Finally, with the hyoid, last but not the least, with the hyoid. Hyoid bone is a U-shaped structure. Now, this is important. U-shaped structure, where it is exactly located, C3 level. But where? How do you feel it? See, this is the larynx. You can palpate the cartilages, the thyroid cartilage, Adam's apple. Go above it. Then just try to feel. You will feel a bony resistance over here, a small one. That bone is the hyoid. Remember, we have to remember by the mnemonic HTC. H above is hyoid bone, then thyroid and cricoid cartilage. The TCR, thyroid and cricoid cartilage. H above is the hyoid. So hyoid bone is at C3 level, thyroid cartilage is at C4, C5 level, and cricoid is at C6 level, hyoid is at C3 level. That is the main part. And hyoid again bone will have a body, greater and lesser horns. It has few other attachments. Mainly muscles and ligaments are attached onto the hyoid bone. It is very important bone. As we'll study pharynx and larynx, we'll understand the importance of hyoid bone. See, hyoid bone is attached where? It is attached to mandible, attached to tongue, attached to larynx, attached to pharynx, attached to the base of the skull. It is a bone which does not form a joint with any other bone. It is not directly in touch with any other bone. but it is touched with all the other structures either by muscles attachment or by ligamentous attachment. And in all those cases, you will see the word that is hyo. Okay, so there will be a word hyo known as. Like here you can see the examples: hyoid, styloid, glenoid, mylohyoid, hyoglossal muscle, sternohyoid, thyroid. All those will have mainly the words hyoid, right? All these ligaments are also there. And let us look at the view. This is the hyoid bone on one side. See, very small bone over here. Coming from developmentally, also they can ask coming from pharyngeal arches, second and third pharyngeal arches. This can also be a question. Okay, so hyoid bone. Just remember, it is forming the center point. It is between the skull and the neck over here. It is not directly attached to any other bone, but it is attached to all the surrounding structures via muscles and ligaments. You can see all the attachments over here. You see all these attachments in this beautifully diagram. All these attachments, maximum attachments are having the word as a hyoid over, either muscles or the ligaments. So remember that part, right? This is one good image of hyoid bone shown to you. The single, so you have this body over here, you have the greater cornu over here, you have the lesser cornu over here. Developmentally, this lesser cornu and body comes from the second arch, greater cornu comes from third arch. So second and third pharyngeal arches. Remember that important topic in our embryology? That is a hyoid. Very interesting one over here. So I'm not going to tell you all the muscles because as we'll come to the head and neck part, you'll see the larynx muscles or the tongue muscles. Then again, those will come, but just go through it. What are the various muscles attached over here? So guys, this is all about the discussion today, osteology. I hope I gave you a general good idea. Remember important bones and foramens, most important part of foramens. Go through it, revise it. Any things which you didn't understood, do us so we can help you out with that, right? Okay, so thanks for watching, and you can also follow our social media handles over here. And don't forget this subscription plans. And that's all from my side. I hope you are good. Let's meet tomorrow again, and we'll discuss the scalp and face. So you have one day to revise fast. Any problems, issue, reach out to us, or you can write in the comment box. So that's all from my side. Thank you. See you soon.